Introduction. Background music. Narrator. Welcome to today's lecture on HIV/AIDS. In this comprehensive course, we will be addressing various aspects of this complex disease, including pathogenesis, transmission, diagnosis, treatment, and the psychological and social impact on affected individuals. So, grab your notes, and let's dive in. Scene transition. Conclusion. Understanding the mechanism of CD4+ T-cell infection and immune system decline caused by HIV is crucial for developing effective strategies for diagnosis, treatment, and prevention of this devastating disease. Closing remark. Understanding the different modes of HIV transmission is vital for both prevention and treatment strategies. By targeting these modes and implementing appropriate interventions, we can work towards reducing the spread of HIV and improving the health outcomes for individuals affected by the virus. Examples of AIDS-defining conditions include pneumocystis pneumonia, Kaposi's sarcoma, and cytomegalovirus retinitis. The classification of HIV/AIDS is based on the severity of immunosuppression and the presence of specific opportunistic infections. This classification system helps guide treatment decisions and prognosis. In conclusion, understanding the stages and classification of HIV/AIDS is crucial for healthcare professionals as it aids in accurately diagnosing the disease, managing its progression, and predicting outcomes. By recognizing the distinct features of each stage, healthcare professionals can provide appropriate care and support to individuals with HIV/AIDS. Closing remarks. Understanding the laboratory techniques used in diagnosing HIV infection is essential for healthcare professionals. Accurate and timely diagnosis allows for proper treatment and prevention strategies, ultimately improving patient outcomes and reducing transmission rates. The video will continue with further discussions on the specific mechanisms of action of the different drug classes, as well as the potential side effects, drug interactions, and resistance issues associated with ART. Additionally, strategies for managing treatment failure, switching regimens, and managing comorbidities will be explored. Stay tuned for more information on this vital aspect of HIV management. Summary. Drug-resistant HIV strains pose challenges to the management of infected individuals. Genetic mutations in viral enzymes can confer resistance to antiretroviral drugs. Combination therapy and viral load monitoring are important strategies to combat drug resistance. Back to the summary. Individuals with HIV face heightened vulnerability to co-infections, such as hepatitis, tuberculosis, and sexually transmitted infections. Screening, vaccination, prompt diagnosis, and effective treatment are crucial for managing these co-infections and improving overall health outcomes. Conclusion. Despite the challenges, the field of HIV vaccine research is continuously advancing. Researchers are optimistic that with continued dedication and collaboration, we can finally develop an effective vaccine to prevent and eradicate HIV/AIDS. Narrator. HIV infection significantly increases the risk of developing various cancers. Understanding this association and implementing appropriate screening and management strategies have become essential components of HIV care. Let's delve into this topic further. Detailed explanation. HIV-associated cancers encompass a broad spectrum of malignancies, including Kaposi's sarcoma, non-Hodgkin lymphoma, cervical cancer, and anal cancer. These cancers occur at higher rates among HIV-infected individuals compared to the general population. The reasons behind this increased risk are multifactorial and include impaired immune surveillance, chronic inflammation, oncogenic viral co-infections, such as human papillomavirus and Epstein-Barr virus, and exposure to environmental carcinogens. Screening and early detection play crucial roles in reducing the morbidity and mortality associated with HIV-associated cancers. Comprehensive cancer care, which includes chemotherapy, radiation therapy, and surgery, must be tailored to the specific needs of individuals living with HIV. Scene transition. Visuals of individuals taking medication, healthcare workers providing counseling, and serodiscordant couples discussing preventive measures. Narrator. By incorporating PrEP and PEP into our preventive strategies, we can significantly reduce the risk of HIV transmission and contribute to the global effort to end the HIV/AIDS epidemic. Narrator. Managing HIV infection during pregnancy presents unique challenges to healthcare providers. In this section, we will explore the various aspects of HIV and pregnancy, including prevention of mother-to-child transmission and ensuring optimal maternal and fetal health. Detailed explanation. Effective antiretroviral therapy during pregnancy significantly reduces the risk of mother-to-child transmission of HIV. Initiating antiretroviral drugs early in pregnancy, maintaining viral suppression, and adhering to treatment regimens are vital to preventing transmission. For women with higher viral loads or other risk factors, elective cesarean section delivery may be recommended to further reduce the transmission risk. Additionally, Avoiding breastfeeding and providing safe alternative feeding methods are crucial to prevent postnatal transmission. Comprehensive prenatal care, frequent monitoring of viral load and CD4+ T cells, and appropriate management of comorbidities, such as opportunistic infections, are essential for ensuring optimal maternal and fetal outcomes. Scene transition. Summary. Living with HIV can result in significant psychological and social challenges. Stigma, mental health disorders, and the importance of social support are discussed as crucial aspects in addressing the impact of HIV on individuals and their families. In conclusion, this lecture provided a thorough understanding of HIV/AIDS, including its causes, treatments, and impact on mental health. Let us keep learning, advocating prevention, and supporting those affected to combat this worldwide epidemic.